Effect of high negative pressure wound therapy in diabetic foot ulcer healing. Early in the 90s, negative pressure wound therapy has been introduced as a new modality that can assist us to achieve our goal, which is complete wound healing. The first studies were animal studies, and it represents that the effective negative pressure lies somewhere between minus 50 millimeter mercury and 150 millimeter mercury. And nowadays, the recommended pressure is about something around 125 millimeter mercury, which is effective in assisting the wound healing. Yet, what is the optimal pressure? That was our question. We searched the literature and hope to find something to answer this question. As in the last guidelines of the International Working Group of Diabetic Foot, negative pressure wound therapy has been introduced and recommended as one of the modalities that can be used in adjunctive to other medical plans, treatment plans. Yet, no randomized clinical studies have compared the effects of different levels of negative pressure on wound healing. So we thought we have to conduct this study, and our aim was to assess the effect of high versus standard negative pressure on the duration and rate of wound healing in patients with non-ischemic diabetic foot ulcers and wounds. For sure, the first step, the most critical step, is how to formulate a study design trying to eliminate any sources of bias as possible. And this is our study. It's a prospective study, randomized, conducted in the Diabetic Foot Center in Egypt from the 1st of July to the 31st of December 2018, in which all consecutive patients with diabetic foot ulcers or wounds for whom negative pressure wound therapy was prescribed were included. We divided the patients into two groups. Group A with the standard negative pressure wound therapy, and we defined it as minus 120 millimeter mercury in our study, and another group with high negative pressure wound therapy, which is minus 160 millimeter mercury. As a trial to eliminate sources of bias, we used the same way for measuring the wound size, which is very simple: plastic ruler and digital photo from a distance of 30 centimeters and perpendicular to the wound. All the infections and wound care were done with the same local protocol in our institute. We used the Wi-Fi classification for the categorizing the wounds. And regarding the machine, we used the same machine manufacturer, the same negative pressure wound therapy vac, and we used the same mode, which is continuous mode. As a trial to be reproducible, the dressing changes performed at our center by the same research nurses every time. We used the foam dressings applied twice per week, and with every change, we irrigated the wound with 1 liter of normal saline prior to application of the device. Our endpoints were complete wound healing, major amputation, and death, and the patients were followed up for 12 months. Now, regarding the results, we had 87 patients in the standard group, Group A, and 88 patients in the high negative pressure wound therapy group, Group B, with a total number of 175 patients enrolled in this study. Both groups were equal regarding the demographics, the comorbidities, the Wi-Fi classification, and the duration of follow-up, with no statistical significant p-value. From this table, we can see that these are the demographics and the comorbidities, and there is no statistical significant p-value. These tables show the Wi-Fi classification, and also we used the Wi-Fi staging system. And from this slide, we can see that still we don't have any significant statistical significant p-value difference. And also that around 50% of the patients in both groups were in stage 4 with increasing risk for losing the limbs. Now, regarding the ulcers completely healed, it was significantly higher, the total number was higher in the group of the high negative pressure wound therapy. and it took less days to achieve the complete healing in the high negative pressure wound therapy, and we had less major amputations also in the group B, with all the three with statistically significant p-value. So our conclusion was, in patients with non-ischemic diabetic foot ulcers, high negative pressure wound therapy resulted in higher healing rate, shorter healing time, and reduced major amputation. And for sure, we still need further studies. So further studies are required to identify the levels of negative pressure that are more effective in specific disease entities. Thank you.